Pulmonary hypertension, or PH, isn't just high blood pressure. It's high blood pressure specifically in the arteries that carry blood from your heart to your lungs. This increased pressure puts a strain on the right side of your heart, making it work harder to pump blood through the lungs. Over time, this can lead to serious complications and even heart failure. This video will explore the causes, symptoms, diagnosis, and management of pulmonary hypertension, providing a comprehensive overview of this complex condition. Pulmonary hypertension can be caused by a variety of factors. Sometimes it arises from underlying medical conditions like congenital heart defects, connective tissue diseases such as scleroderma, HIV infection, liver disease like cirrhosis, and chronic lung diseases such as COPD and pulmonary fibrosis. Certain medications and recreational drugs have also been linked to PH. In some cases, no clear cause can be identified. This is known as idiopathic pulmonary hypertension. And finally, a family history of PH can increase your risk, pointing to a genetic component in some cases. To understand the impact of pulmonary hypertension, let's explore its pathophysiology. Normally, the pulmonary arteries are flexible and elastic, allowing blood to flow easily. In PH, these arteries become narrowed, stiffened, or even blocked. This narrowing increases the resistance to blood flow, forcing the right ventricle heart to pump harder to push blood through the lungs. Over time, this increased workload causes the right ventricle to enlarge and weaken, a condition called right ventricular hypertrophy. Eventually, the right side of the heart may fail, leading to heart failure and decreased blood flow to the lungs, resulting in shortness of breath and fatigue. Pulmonary hypertension is a relatively rare disease, but its prevalence varies depending on the underlying cause. It's estimated that idiopathic pulmonary hypertension affects a small percentage of the population. However, the prevalence of PH associated with other conditions, such as connective tissue diseases or HIV infection, can be significantly higher within those specific groups. It's important to note that PH can affect people of all ages, but it is more commonly diagnosed in women than in men, particularly in the idiopathic form. Further research is continually being done to understand these demographic trends. The symptoms of pulmonary hypertension can be subtle at first and may be easily mistaken for other conditions. The most common symptom is shortness of breath, especially during exercise or exertion. Other symptoms include fatigue, chest pain, dizziness or fainting, swelling in the ankles, legs, or abdomen, and a bluish tint to the skin or lips, known as cyanosis. As the disease progresses, these symptoms may become more severe and occur even at rest. It's crucial to seek medical attention if you experience these symptoms, especially if they are persistent or worsening. Diagnosing pulmonary hypertension typically involves a combination of tests. A doctor will start with a physical exam and review of your medical history. Common diagnostic tests include an echocardiogram, which uses sound waves to create images of the heart, a right heart catheterization, which is the gold standard for measuring pressure in the pulmonary arteries, pulmonary function tests to assess lung function, a ventilation perfusion scan to look for blood clots in the lungs, and blood tests to rule out other conditions. Imaging tests, such as a chest X-ray or CT scan, can also provide valuable information about the condition of your lungs and heart. Early and accurate diagnosis is crucial for effective management of pulmonary hypertension. Pulmonary hypertension is classified into different groups based on the underlying cause. Group 1 includes pulmonary arterial hypertension, which encompasses idiopathic PH, heritable PH, and PA associated with other conditions. Group 2 is pulmonary hypertension due to left heart disease. Group 3 is pulmonary hypertension due to lung diseases and/or hypoxemia. Group 4 is chronic thromboembolic pulmonary hypertension, caused by blood clots in the lungs. And Group 5 includes pulmonary hypertension with unclear or multifactorial mechanisms. Understanding the specific classification is essential for determining the most appropriate treatment strategy. While there is currently no cure for pulmonary hypertension, various treatments can help manage symptoms, slow the progression of the disease, and improve quality of life. Treatment options include medications that dilate the pulmonary arteries, such as endothelin receptor antagonists, phosphodiesterase 5 inhibitors, and prostacyclin analogs. Anticoagulants may be used to prevent blood clots, and diuretics can help reduce fluid buildup. In some cases, oxygen therapy may be necessary to improve oxygen levels in the blood. For patients with chronic thromboembolic pulmonary hypertension, a surgical procedure called pulmonary thromboenterectomy may be an option to remove blood clots from the pulmonary arteries. In severe cases, lung transplantation may be considered. A comprehensive management plan, tailored to the individual patient's needs, is crucial for optimal outcomes. While not all causes of pulmonary hypertension are preventable, certain lifestyle modifications can reduce your risk and improve your overall health. These include avoiding smoking and exposure to secondhand smoke, maintaining a healthy weight, managing underlying medical conditions such as sleep apnea and connective tissue diseases, and avoiding certain medications or recreational drugs that have been linked to pH. Regular exercise, under the guidance of a healthcare professional, can also help improve cardiovascular health. By adopting a healthy lifestyle, you can minimize your risk factors and potentially reduce the likelihood of developing pulmonary hypertension. The prognosis for pulmonary hypertension varies depending on the underlying cause, the severity of the disease, and the individual's response to treatment. Without treatment, pulmonary hypertension can be a progressive and life-threatening condition. However, with early diagnosis and appropriate management, many individuals with PH can live longer and more fulfilling lives. Recent research has led to the development of new and more effective therapies, offering hope for improved outcomes. Ongoing clinical trials are exploring novel approaches to treating PH, including gene therapy and stem cell therapy. As research continues, we can expect further advances in the diagnosis and treatment of pulmonary hypertension, leading to better outcomes for patients affected by this challenging condition.